Hi, I'm Leah Binder. I am President and CEO of the Leapfrog Group, and I have a great pleasure today of meeting some really interesting people who are leading the country in their level of transparency and commitment to quality and safety for their patients. I'm meeting with Stephanie Jaros. She is ASC Director for the Center for Spine and Joint Replacement Surgery. And I'm also meeting with two of her colleagues there, John Hamilton, who's a surgical technologist, and Danielle Knudsen, who is a nurse at the same ASC. So I'm really pleased to meet you. You were among the first in the country to participate in the Leapfrog ASC survey when we launched it in 2019, and you've continued to participate. That really is a great leadership on your part, and I'm really excited to hear about how it's gone for you. So welcome.
Thank you for this opportunity, Leah. We're excited to share lessons that we learned and also in hopes of just improving.
Well, that's what we're all trying to do, isn't it? Improvement across the country for everyone. So why did you decide to participate as an ASC in the Leapfrog survey?
Yeah, so in 2018, I was fairly new to the organization. Our VP of ASC operations at the time approached me and a couple of our other surgery centers in our organization to see if we would be interested in participating in your pilot ASC survey. Coming from a hospital setting, I was familiar with Leapfrog and the reputation it has for building transparency and allowing patients to see what facilities are working on. So I was really excited for that opportunity. And I said yes, resoundingly. And it turns out that there was a lot of ASCs that were interested. And Leapfrog decided to open up the survey for anybody who was willing to participate. So actually, ProLiance had, I think, 13 or 14 of our 18 surgery centers participate in that initial survey.
Yes, which we were really excited to see. When we first started the ASC survey, we weren't sure that we would be able to pilot it the first year with as many ASCs as wanted to participate, but we were able to do it. So I'm glad to hear that that was useful and helpful. And so why do you care about transparency? I mean, we do make public the information that we get from you and other ASCs. Why is that important to you?
I think that across the ASC industry, there is a drive to show patients that we are delivering the same, if not better, level of care that the surgery in the hospital is performing. And as of yet, there's really not a national platform available to ASCs, not only to show patients, but to show each other what we're working on. And we have a culture in our surgery center that we can't get better if we don't identify and talk about concerns or mistakes. So for me, this level of transparency is essential to reassure our patients that we're working on things like infection control and hand washing and employee engagement, and also for the staff to know that administratively this is also important.
Well, that makes a difference also in your community. I know it really matters to people. We've been doing surveys, as you point out, at the hospital level for almost 20 years. And we have found that it is reassuring to communities and patients. They don't expect perfection, but they do appreciate candor. And you're showing the highest level of candor when you participate. So it is appreciated. So one part of the Leapfrog survey asks about patient follow-up procedures. And I know your facility has really gone above and beyond on that. Can you tell us more?
Yeah, this is something that I think has come along with the fact that we are a center for total joint replacement. So one of the systems that we have in place allows patients from the beginning of selecting surgery all the way to the post-op experience to have a platform with kind of access to their surgeon. And in that platform, they have the ability to put in information like the pain level that they're having post-operatively, the amount of medication they're using, and just in general feedback of how things are going, how they're progressing. And it's, user dependent, right? If it's as much as the patient wants to put in or not. And that information goes back to the surgeon's team so they can collaborate on improving outcomes based off of what patients are reporting. And another system that we use that I think a lot of surgery centers use is, platforms for patient satisfaction. So ours is outsourced to a vendor that allows for us to collect that information and benchmark it internally with other ASCs in our organization, but also nationally. And then more recently, we've partnered across Proliance with our clinic partners to use a platform to reach patients postoperatively on day 7 and 14 specific to COVID and symptoms, so that if the patients are experiencing something that's concerning, they can get their healthcare team involved more quickly.
So a patient then goes home after a procedure, and if in the middle of the night they are having a lot of pain, they can communicate that to you through the portal,
they can report it, as more of like a diary. And, obviously we have the ability, with a 24-hour phone call system for them to call into the clinic and get a hold of their surgeon or the on-call surgeon if that's not a manageable pain level.
That's also a great thing too, though. We don't necessarily think that is ubiquitous across all ASCs, that capacity exists. So that's good to hear too, to have an on-call provider at 24 hours. That's great.
Yeah.
I'm sure that's a great boon to your patients to have both ways of communicating continuously. That's great. Did the Leapfrog survey help you identify areas in your overall performance?
Yeah, it did. With the 2019 inaugural or the pilot survey, there were a couple areas that highlighted, not concern for me, but oh my gosh, this is something that I should be working on. And in particular was patient or medication reconciliation. And although we had a process in place to kind of audit this process, particularly because it's required for accreditation and licensing, it wasn't robust. We weren't doing hardly a portion of what kind of was the, Leapfrog was kind of asking for. So I couldn't actually even participate in that part of the survey because I didn't have the volume of audits to kind of meet that minimum. And so I came back to the team. We really dove into our chart audit process with a focus on medication reconciliation and kind of journey from home medication reporting and allergies all the way through and verifying that orders are made correctly, are executed properly, documented, and that the medication reconciliation goes home with the patient. And that was a direct result of doing the survey and realizing, oh, this is an area of opportunity. The second one was around employee engagement and specifically what we've referred to as the culture of safety survey. And although Proliance was working on this, it was still kind of we're going to get to it. And after participating in the 2019 survey, I went back to my VP of operations and said, when this survey happens again next year, I really want to be able to say, yes, we've conducted this survey, and yes, we involved our staff in this process, and it really did kickstart that effort for the organization. And by the 2020 survey, we were able to say across all of our ASCs that participated that we did this, that information flowed back to our governing board and our staff, and which felt good to see that improvement from one survey to the next.
Did you see, from medication reconciliation or for culture of safety, did you feel like you saw improvement in those areas?
Oh, definitely. We haven't had our repeat yet for our employee engagement survey, that's annually, but for medication reconciliation, the way our audits function, the nurses, the scrub tech, we all had input in the audit, and that duty gets circulated among the staff. So seeing each other's work identifying the workflows. You know, things have come up where we identified that our electronic medical record wasn't documenting, you know, medication doses correctly, right? And you don't see that unless you're looking at the aftermath of the chart, which we, you know, intuitively say, oh, I should look and see what the chart looks like after it's all signed off. So that has helped us to continue to improve several systems that we use for patient care.
Oh, that's great to hear. So let's talk now about employee morale, and has the survey affected that?
Yeah, actually, I think that's probably best answered by John and Danielle, so I'll let them scoot in and have an opportunity to address that for you.
Yeah,
John.
I think it has. Hi. I think it has really helped morale in the sense of it puts all the staff on the same platform. Everyone is working towards the same goal of safety, and so therefore, you know, materials management, reception, sterile processing, scrub techs, nurses, everybody is equal in this, and I think that gives a better sense of being a part of the team.
That's terrific. And that's how you create a team, is when you all know what the goal is.
Right.
Right? You gotta know the goal.
Absolutely.
That's
and
wonderful.
Now I will let my coworker step in and
Danielle.
be a part of it.
Yeah.
So how is it affected? How do you see it affecting morale?
From my point of view as part of the staff, Leapfrog has really been in step with the culture that we have been cultivating here at our ASC from the very beginning. From the very start, we've had a very open, collaborative environment, and so I think it was an easy way for us. Like Leapfrog was easy for us to step into because it's already something that we have been doing without the name Leapfrog. It helps open up discussion with our director and allows our voices to really be heard.
That's great. Well, and that's also important for your community as well. I mean,
yes.
The fact that you are already doing a lot of these things without the name Leapfrog is great, and it gives you recognition in the community for that fact, because that means that you're performing at an exceptional level, because Leapfrog sets a very high standard. So that's great, and you deserve that recognition.
Thank you.
So let me ask you another question. Have you found through Leapfrog that you're prioritizing patient safety more or less or the same, and particularly as it pertains to enduring this pandemic that we are all in the midst of? Do you think it's helped or hurt?
Oh, I would say helped. I think for patient safety, specifically during the pandemic, we've really learned how agile we can be as a facility. We've learned how flexible we are, and that even though it's hard to change our practices, that we can do it. We've had to implement patient and staff screening. We had to find ways to test patients before their surgeries, and that really, we've never really been like a lab, and so we've had to figure out how to utilize laboratory resources and learn their processes and how it's going to fit into our processes. And we had to work and go through a few obstacles to find the right vendor to suit our needs and to best suit the needs of our patients. And now we're in a pretty good place with our testing processes. We have a plan with a backup plan, and everybody is, all of our patients are able to be tested, and we're able to practice in the safest manner for both our staff and the patients.
That's great. That's great. And John, what's your perspective? Do you think that it's helped to participate in the Leapfrog process, the survey process in the
Absolutely.
era of pandemic?
Yes, it has helped tremendously, I think, both for staff and for the patients and the community. Certainly help aids in transparency, I would imagine.
Well, right, and that's of great importance to everyone.
Yeah.
Thank you. Well, let me go back to Stephanie, if I could. Stephanie, you're over there, right?
Yes.
Has the survey process helped you to fine-tune your overall quality improvement efforts?
Yeah, I think that the survey for me is a check and a balance, right? Because I think before participating in the survey, my network of what other facilities are doing around quality improvement and safety is somewhat micro community with the other ASCs within my organization. And this platform being national, being open to just a wide variety of ASCs, helps me see what is important, right? Am I on the right track? Am I missing something? And, you know, and my hope is that as the survey develops, that it does help kind of guide us as a mass of all the ASCs in that direction. Because if we're all focused on quality and improvement, you know, that synergy can improve, you know, many things for patients.
Well, that is good to hear, and it is a challenge for us at Leapfrog in the future to make sure that we are always up to the minute in the best quality improvement strategies that are out there, so that we are able to offer almost a checklist for ASCs to see these are the kinds of things that your peers are doing, these are the best practices, and so that is important to us. So I appreciate that, and we'll be looking to ASCs like yours to help us get there, because we learned from you, from what you tell us in this process. So do you have advice for your colleagues and for us?
Yeah, I would say that that participating in the ASC survey itself is an important step in at least encouraging your whole team that transparency is important, that being willing to show that we might not be the best is okay. It gives us an opportunity to improve. And I think that question too, directed towards Danielle and John, they have some perspective on what to kind of maybe say to other ASCs that are interested or on the fence of whether or not they are willing to participate.
Great. Well, do you want to, what would be your advice, John?
Well, the way I see it, why wouldn't an ASC want to participate in the survey? You know, it's only going to improve their quality. Why not? If you don't, what are you hiding, or what are you afraid of? That would be the perspective I would imagine that people would have if you're not willing to participate. Danielle?
Thank you, Danielle.
We didn't prepare for our first survey. We were participating just as we were in that moment or in that time frame. And we didn't know what would be on the survey or how we were going to relate to the survey. And that it can be scary. But the reality is that if we want to improve, we have to be willing to remove the shame from the process. So if we, you have to identify the areas in which you have room to improve. We all have room for growth, and the only way to achieve that growth is to identify the needs. And we have, honestly, a fabulous support system to make that happen. A lot of credit should go to our director, because she definitely she creates a safe place for us to be able to grow.
That is extremely inspiring. Stephanie, congratulations on hearing that. And that is to a credit to you as a leader, and a credit to your ASC, and a credit really to your whole organization, because you're really making a difference in a lot of people's lives and your patients' lives. And we're just very proud to be by your side for that journey. So I really appreciate your participation, and I really appreciate your sitting down with me today. I've learned a lot from you all, and I'm very inspired and glad to hear about this wonderful work. So thank you.
Yeah, the pleasure is ours. Thank you so much for involving us, and I hope that with that, the ASC survey continues to be a collaborative process between Leapfrog and the participants. And I think with that, its exponential growth and how it will benefit us is inevitable.
Well, I'm excited to have you at our side as we go forth and make a difference together. So thank you.